There we go. And I wanted to introduce Michael Williams from LMH Health, and he will introduce his colleague Taylor Buchanan for us.
Great, thank you, Kathleen. My name is Michael Williams. I'm the Vice President and Chief Information Officer at LMH Health, and I've been with the organization for about 22 years. We have had our portal in some form for about 18 years. So we've gone through the terrible Tues and then gone through those awful teenage years. And I think we've got a really good portal that's really has a lot of very valuable information on it. And so today, my colleague Taylor Buchanan, who is our integration engineering manager in our IT department, he does a lot of technical work with our EMR, but also does a lot with the portal. So he is our resident expert. And so I'm going to let him go through the presentation today. So Taylor, I'll turn it over to you.
Thanks, Michael. Hello, everybody. I'm Taylor Buchanan. I've been at LMH for about 20 years, not all of it in IT, but the majority of it has been. I mainly focus on the application side of our electronic medical record and the ways that patients can interact with it. So patient portal is kind of my baby. So I'm always excited when I can get in front of folks and show everybody what we have to offer. So for a quick rundown, I'll first talk about how to sign up. Then we'll go through a quick tour of the site using a dummy patient with some information in there so you can see what things look like when you get logged in. So there's a couple ways to sign up. The first is to self-enroll. So if you go out to our website, lmh.org, and I'll show you where to go once you get out there. There's a way that you can sign yourself up without having to come into LMH or get an invite sent to you via email. As long as you provided your email address at a previous visit to us, you can go out to this self-enrollment page and enroll yourself, set your password and log right in without having to sign any paperwork or anything like that. The other option is to go ahead and enroll in person. So when you're checking in for a visit at our clinics or registering for either an inpatient or outpatient visit at the main campus or over at our West campus, our registration staff will offer you access. They'll ask if you want an invite, they'll ask you for your email address, and then we'll email you a link where you can start the process of setting your password and signing in. So with that, I will jump right into the site. So we'll start on our LMH homepage. So this is lmh.org. There's a white button up in the upper right-hand corner here that I'll click to go to our portal login. This is also the place where I can start the sign up process. So there's a few links over here on the right-hand side where I can sign in if I've already got an account. If I don't have an account yet, I can click the sign up for an account and start that self-enrollment process. The information I provide here has to match exactly what LMH has on file for you. So name, date of birth, and the email address all have to match so we can link you up properly and make sure we've got you linked up with the right account in our system. So I'll go ahead and sign into an account. So again, I'm going to the patient portal button up here in the upper right. And then I'm going to click the sign into your account link over here a little lower on the right. And I'm going to go ahead and sign into my demo user here. And when I first get signed in, I get a dashboard with a few key metrics that we think people will want to see face up right when they sign in, and some quick links both along the top and the side here. So over here on the right-hand side, I've got my most recent results, both vital signs and a subset of lab results. So things like blood sugar, LDL, height, weight, BMI, the stuff that folks we think want to see most commonly will show up on the right-hand side here, along with my allergies as well, if I've got any allergies. The links along the top here are some of the most common things that folks look at. So we try to make these as accessible as possible. So I can view my inbox, I can view my notes, I can schedule an appointment, and we've got some frequently asked questions out here as well. If I've got a question about when something appears or how to get to something, I can click this link here for some help. So I think I'll start first with the messaging section. So this section looks a lot like an email inbox, but it behaves a little differently from email. When I'm going in here and looking at messages or sending messages, I'm interacting directly with the computer system at LMH. So everything is encrypted and secured. It's not going over the internet to send my messages to my provider. So when I come in here and I can, if I have a message from a provider to view, I can view it here in my inbox and just click it just like an email. I can review it, forward it, send it to the trash, or reply just like a regular email. To compose a message, I click the send a message button here at the top of the inbox. From here, I would provide a recipient. So I can either start to type my provider's name if I know the provider, or I can start to type a clinic name. So if I type, for example, Dr. Nichols at Free State, I can type her name, or I can start to type Free State. And I'll see all the providers at Free State that I can pick from. I can set a subject and a message. I can also attach files. So if I've got a picture that I want to attach of something that I'm concerned about, or if I've got some documentation maybe from another provider that I want to send over to my doctor at Free State, I can click the choose file button and attach any files that I want to attach to the message. And those will go into the electronic medical record and become part of my chart. I want to actually send a message here because that would actually go to the provider. When I do send a message, it's routed to the nursing staff for my provider. So if it's a simple question that the nurse can answer, they'll answer it directly. If it's something that's a little more involved that needs to go to the provider for a response directly from the provider, they'll forward the message on to the provider themselves and they'll reply. The other sections of the messaging category here are, again, a lot like an email inbox. I can see messages that I've sent. I can also, if I accidentally trash a message, I can come into the trash and pull it back out if I need to. Next, let's look at the appointment section. So there's a couple of options under appointments here on the left-hand side. The first is a view of my upcoming appointments with LMH. So if I've got appointments scheduled at the clinics or on the outpatient, in the outpatient departments at LMH, I'll see those here all in one view. I can see the date and time and provider that I'm scheduled with, as well as the type of appointment that I've got scheduled. If I have a question of where a clinic is located, I can click the clinic name here. And it's going to take me out to Google Maps and show me right where my appointment is at. You can also click the view instructions link. Sometimes providers will have additional instructions or preparations you'll need to take before you have an appointment. And I can review those instructions here under this instructions link. Over on the right-hand side under options for an appointment, I can add it to my calendar. This works on your phone too. So if you go to the website on your phone and log in, you can go to this options link and add it to your calendar on your phone under this link here. We do have an option to cancel an appointment from here, but right now we do ask that folks call to cancel appointments. That way we can streamline the process of getting things rescheduled versus having to email back and forth or send messages back and forth. The other option under appointments is self-scheduling. So this is a pretty neat feature that we've been working on for a while. This turns the process of scheduling an appointment with LMH into a lot like booking a hotel room. So when I come to this schedule a new appointment view, I first choose the type of appointment that I'm looking for. So we are rolling this out pretty deliberately. So there isn't a huge list of appointment types that are available yet, but just for the sake of example, I'll choose routine physical here. And when I click search, these are the locations at LMH that offer that routine physical appointment type. So if I click on, let's choose Mount O. So I can choose, if I've got a particular provider that I see at Mount O, I can choose them from here. Again, not all providers are enabled for this yet, but we are rolling folks out as we go. For the providers that are available, I can see their availability here and choose a date and time that works for me. From here, it's going to ask me for some more details about my visit, if I've got any other concerns that I want to address, in addition to the appointment or the particular appointment type that I selected. It also asks me how I'd like to be followed up with, if I just want to message back confirming the appointment, or if I would like a phone call to confirm it. From here, if I click schedule appointment, it puts my appointment on the schedule and I'm done. I don't need to call to confirm or anything. I just need to show up for my appointment. Do we have any questions over those? Just looking through the chat. Looks like we're okay. So I'll dig into the health record section now. So the first section at the top here is a summary view of things that are contained in some of the other sections down lower here. The medication section shows me any active medications that I'm on that are managed by LMH. So I can come in here and see more info if I need a reminder of my dose or frequency of a particular medication. I can also come out, and anywhere you see this learn more about this link, you'll see this throughout the website for medications or results. You can click that link and it'll launch out to a sort of a directory of more information about whatever context where you click that link. So in this case, since I clicked it for a medication, it's going to tell me more about that med, what happens what I should do if I miss a dose, interactions, side effects, things like that. Further down on the summary view here, I can see immunization history. I can see any allergies that are on my chart. So I've got an allergy to wool and my reaction is hives. I can also see any active health issues. So these are those chronic problems that I have that'll follow me between appointments. And again, we got this learn more link. If I end up with a problem on my list that has a very scientific description, I can always come out here and click this, learn more about this link to get a more, hopefully a more layman definition of what something means. The next section in the medical record or the health record is clinical notes. This is a pretty popular one because it lets you view your provider notes from your visits with LMH. So if I come out here to clinical notes and click on the title of my note, it'll take a second to load here and then show me the note that my provider signed on any particular visit. So I can come out here and see exactly what they put on my chart. From here, I can print it out. I can download it to my computer or to my phone. I can do anything I need to do with it. It's my document now. So it's also a download button over here. It does the same thing. It just downloads a PDF file of that note, so I can send it on to another provider or provide it to a family member, whatever I need to do with it. Medication section is pretty much the same as what was in the summary. There is a refill renew button here. So for controlled substances, so things like pain medication where the provider needs to go out and actually approve that renewal before the pharmacy will fill a renewal request, I can come out here and click this button and request that renewal from the website rather than having to call the clinic. That way, it would also save a call to the pharmacy as well. So that way they don't have to play phone tag. The vitals and lab results section shows me that same list of key metrics that is visible on the dashboard. So again, this is a subset of things that most folks are interested in, common results that most folks want to see. And then my lab results are split out by type as I scroll down further here. So things are split out into like chemistry, cardiac studies, infectious disease, things like that.
Taylor,
yeah.
Sorry to interrupt. So Maggie Chipman in the chat had talked about the point of care testing, that are done, that's performed in the clinic, not in the lab. That shows up under the results here, correct?
I need to check on that. I think we might need to make a change.
So I had pulled up my point of care A1Cs that I get, and they showed up under the chemistry. So
Okay, good.
if somebody, Maggie or anybody else, if you're not seeing those point of care results, you can go to the website, and at the end, Taylor can show you where that is, where you can communicate with us with just a general note. Or you can send a message to your provider and let them know that that's not showing up, and we will make sure that that is available to you. Okay, Taylor, thank you.
Sure. So before we move on here, my test patient, my example patient here only has one set of labs on them, but if I had multiple results for a particular test type, I can come out here and click on that test, and then it would show me that trend of my results over time. So I'd be able to see for things like blood glucose, if things are improving, or if I need to work on something, I can come out here, click on a particular result and see multiple entries for that result under there. I've also got that same learn more about this link. So I can come out and get more information about a test result if we have it mapped. I'd be able to see more information about the result type that I click on. Next section is radiology reports. So this is a section where I can view the report itself for any radiology studies that I have done. I can't see my images, so I won't be able to come out and like view a broken bone, but I can open up the report and see the report itself. So this looks a lot like a provider note, but it's my actual radiology report that was signed by the radiologist.
So Taylor, there was a comment in the chat about being able to see the images. And I do know that other organizations, other healthcare providers do allow the images to be viewed. We don't have that functionality yet in our patient portal, but we're hoping to get that in the future. So watch for that. We don't really have a timeline on that, but as Taylor mentioned, this is the report, not the images. Okay.
The pathology and microbiology sections are a lot like the radiology section. So if I've got a pathology report or micro results, I can view those here as well. I just don't have any on my test patient to show. They would look a lot like the radiology report, where I could come and view it or download it, just like the other documentation. Procedure history lists any procedures that were performed at LMH or any that were taken by history by nursing staff during an intake process, so that I can see those both side by side here in the procedure section. The document section is another popular one because it contains the discharge documentation. So when I'm discharged from either a hospital stay or a clinic visit, I'm usually provided a packet, a packet with a bunch of papers in it that I sign. If I throw those away or lose them and want to reference them later, I can come out to this document section here and open up my summary just like the copy that I was provided in person. So it'll have this is the summary that's provided during a clinic visit. So it has what the visit was for, who it was with. It has my next steps, so my next appointment with LMH, any vital signs that were taken during my visits, all just kind of in one document here. One piece I did want to point out is it also has my medication list on its own page. So I can come out here and print just this page with my medication list, so I can put it on the fridge or have it to reference. That's where I can find that in a nice printable form here. The other document that's available on the document section is just patient education. So the patient education documents that the provider selects during a visit are provided in that discharge packet, but they're also available separately here. If I want to just print out the patient education itself, I can come out here and click the patient education link and then print out just those pages. The visit and record summary section gets a little technical. So this is a way that I can download a computer readable sort of synopsis of my chart. So if I click on this, it's not going to look very pretty. I can still read it, but behind the scenes, there's a lot of code in this document that other organizations can use to import my data into their record. So for example, if I'm seeing a provider outside of the LMH system at, say, KU, I can send them this document and they can import it into KU system and bring in all of my history in with that one step versus me having to, write down a bunch of history on paper or provide it to them verbally. I can send them this and they'll have a more succinct history with what LMH has on me, at least. And the way I can send that are these buttons over here. So I can download the file and send it myself, or I can click the send button here and I get a couple of options. The send direct email is a encrypted method of sending this document to other hospital systems. These days, most systems have a special email address that's called a direct email that can be used for this. It's definitely the preferred way to send it. It's not the only way. I can send it using unsecure email, but the message isn't encrypted when I do. So that adds a little bit of risk that somebody might be able to intercept my file. So if you are sending these out out to another provider, always ask if they have a direct email address that you can send to versus a regular email address. Finally, the last section here is obviously relatively new. It's the COVID Center. So this is a one-stop shop to display immunization history for COVID vaccines specifically, as well as your COVID test results. So you can come to this page and print it out if you need proof of either vaccination or a negative test. You can print that here. You can also click this view vaccine verification. This is going to take me to a page with a QR code on it where if venues are asking for a barcode that they can scan for proof of immunization, I can print this out from the website and then show them this barcode as proof. That's it for the health records section. So look at the personal information section here. So this is a section that lists my demographic information that LMH has on file for me. So if I have a change of address or a change of phone number, if my insurance changes, or if I have a change in contacts like emergency contact or PCP, I can come out here and change whatever I need to, and then submit that to either a clinic or to patient accounts at LMH. So this doesn't directly update my record. It generates a message back to LMH for them to review. And then they'll update my record with my requests. So to send that, it's a lot like sending a message to a provider. I would just start to type the clinic name that I'm affiliated with. I'd click that, add any comments that I need to, and then click the send request. And then once the front office staff or the patient accounting staff has updated my record, they would reply with a confirmation of that. If we go back to the dashboard page, there is one more piece I'd like to show, and it's this forms section here. So this is another feature that we're just starting to roll out, and it's the ability to fill out forms electronically before my appointment. So in this example, I've got an appointment coming up for neurology, and they've sent me some forms to fill out before my appointment. So if I click the forms link here, this essentially gives me a way to fill out those forms that were traditionally on paper. So asking for history or any medical changes, being able to fill those out electronically before I come into my appointment. That way it streamlines the intake process once I'm there in person. So this shows me any active medications that I'm on, a lot like what's in the health record section, but I can indicate if I'm taking them or not taking them as prescribed, or if I've stopped. I can also add any new medications that I'm on that LMH may not know about yet. So I can click the add new medication here. I can type the medication name, any information I have on it, as much or as little as I know, and submit it that way. Can also add any new allergies or modify anything that's here as well. If I have a new reaction to something, I can add that in. Can add any new health issues or modify what's on my chart. So if I've got a new complaint, I can come out here and add that here. This is where I could add any procedures that have occurred since my last appointment. So if I had a procedure outside of LMH, I can put in the details here. It prompts me for the name of the procedure, an approximate date. It can be a specific day or just a year. And if there are any comments that I'd like the provider to know about, I can add those here as well. Any immunizations that I've had since my last LMH visit, I can add those in. And this just gives me kind of a step to review my answers before I submit them. And then once I do, it sends a message to my clinic and apparently logs me out. Sends a message to my clinic where they can import that information into my chart before I actually show up for my appointment. And that way I don't have to ask those questions again as we're going through the process of getting ready for the provider. So I think that is Portal in a nutshell. Were there any questions that we needed to address?
Anybody have any questions? I guess, can you go, I know this is like if you have it on your computer, can you just talk about how you download the app? Because I mean, like when I use the portal, I use it on my phone.
Yeah. Yeah, so you can use the website on your phone, or you can go to LMH.org and then go to the portal section here. And we've got links to our apps here on the app stores. You can also just search the app stores for LMH Health and those will show up there. So the app in the app store is called LMH Health My Patient Portal. It looks pretty much exactly like the website. It does it stores your password, which is nice. So you don't have to type your password in each time you want to log in. And it does send a notification to you when you get things like a new message or a new result. if you've got the app on your phone, you'll get a notification that you've got something new to look at.
Yeah, it's really handy.
So I think Jack has a question.
Let me unmute. This was a little complicated to write, but I get medical care from LMH providers, but also from the VA. For example, my annual physical I do through the VA because they do many more tests than Medicare does. So, and then I bring the physical results on a piece of paper to my provider and they scan them in, but they don't show up on the dashboard. So I assume if a doctor's like looking really quick because I'm in the emergency room, they're going to see what my results were 3 years ago and not the most recent. Do I have to put all those results in somehow, or is there some way that eventually you guys will connect with the VA, or what's going on?
Taylor, do you want me to answer that one?
Sure, that's fine.
So there are a couple of things related to that. So when you're bringing that paper in and we scan it in, when you go to the ER, the physicians have a different view than the portal. So they would be able to see that you have external labs available.
Okay.
But the other thing is the VA participates in a data exchange called Commonwealth. And if what we can do from our EMR is we can query Commonwealth to make sure that you're the right person. And then we can see the providers can see that data if it's available through Commonwealth. And so,
Okay.
so we actually share a lot of providers participate with Commonwealth. So we exchange data with KU Med, Stormont Vale, the VA, and a number of other local organizations. So we do have that available to us.
Okay, that's great. And I guess my real concern was that some other doctor would be able to open it up and see my most recent information, not whatever's on the dashboard.
Yeah, they should be
Okay.
able to see that. Yes, sir.
Okay, thank you.
There was a question in chat about resetting your password. So if you're having trouble signing in,
Did you
Go
put
back
it in
to-
the chat, Dave?
yeah,
Well, if you
I'll,
want to answer you have to unmute it if you want to ask him a question.
Maggie and Dave, do you have a question?
Yeah, I did have one. Am I muted?
Yeah, no, you're good now.
Okay. The question I had was, I carry medical information around in my billfold in case of an emergency. If I get taken to LMH, do they automatically have that information, or do I have to sign some kind of waiver from the portal?
So the information that's available in the portal, our physicians and nurses have access to that same data.
But not if they're not in your system.
Correct. If they're not in our system, then we would not necessarily have that information. That's correct.
Okay.
So you have to enter it yourself.
So
All right.
if you did have, so let's say you did go to a specialist that's outside of LMH Health, and you ask them to send that information to your primary care provider, then we would have access to that because we would scan it in, and then all of our providers would be able to see that. So the emergency department would be able to see that. But again, that's your specialist would have had to have sent it to your primary care provider.
Okay. So I would still have to maintain that red envelope you put on a refrigerator with your medical information on it.
Yeah.
The
And
EMTs wouldn't
that-
necessarily automatically get that.
Correct. And that's also a good idea because the emergency services, they don't have access to our EMR and the same data. So if you did have that with you, they would be able to access that, on site if emergency personnel were to arrive. So it would be a good idea to keep that.
Okay, thank you.
I know you've mentioned this before, but if, say you're on the portal and you're, running into issues or problems, is there a handy place to, find where you can send an email or ask a question or make a phone call just to kind of solve your problem? Like a contact us button, something like that.
Yeah, so if you go out to the frequent questions section here, there's
Okay, perfect.
a phone number you can call here with questions. They can also help you reset your password too if you're having trouble accessing.
Okay.
I did want to note on the sign in page, if you are having trouble signing in, there is a forgot password link here.
Okay.
So you can provide your username or your email address, and then it'll send you a link that will help you get reset and get logged in.
So on the, make an appointment interface, are all the LMH providers, can you do online appointments with all of them, or is it just like on my portal, I'm only showing a certain number and my doctor's not listed?
Yeah, so you can't directly do the like hotel booking process for every provider today.
Okay.
What you can do is select this other reason if what you need isn't listed or if your provider is not enabled for self-scheduling yet.
Okay.
And that's more of a request form
I see.
that will send to your clinic and they'll reply with times. And that way you can schedule electronically that way.
Perfect. Great.
Is there a way on the portal to have access to other family members? Like if you have children or even your spouse, can you, I don't know, jump across?
So that process is a little bit complicated. So it depends on age. So from age 0 to 12, parents can have access to proxy into their child's account. And that can be set up at the front desks or inpatient accounts at LMH. You can't do that via the self-enroll process. Where it gets a little tricky is age 13. So due to Kansas privacy laws, we have to cut the parent off from access because there are certain types of information that parents can't have access to without child's consent. And we can't filter those out. So we just have to cut off access at age 13. The child can re-enroll themselves or reauthorize their parent to have access at age 13, but we do have to cut that access off automatically on the 13th birthday. And we do warn the parent that that's coming up and that's going to happen. So when you do sign in, you'll see a message that explains the process. Then at age 18, the child can re-enroll. They can add their parent back in. All bets are off at 18.
Can you do that with your partner too, your spouse? Can you give them permission or they give you permission?
So we can do that through medical records as long as there's a consent form on file that allows for that. They can do that. Just the way that the privacy laws are, we really have to have that written consent, which makes it a little complicated. So again, this is your medical record. So I would not recommend it from an IT security standpoint, but if you do share your login and password with your spouse or partner, they would be able to log in as you and see your information. Because again, you're controlling that. Now, from a security standpoint, I wouldn't recommend that, but that is one way that you can do that. Or you can go to medical records. They do have a consent form that you can fill out and then grant access.
Okay, thank you.
Mm-hmm.
We have both of us on one, so
Yeah.
I'm not sure how it happened. We've been on it for a while and we obviously have the consent. But when we open ours up, it allows us to toggle right back and forth between everything. And it's really a safeguard should something happen, and, you know.
Except that messages only come to his email, not to
Yeah,
mine.
we have all the messages come to one email, and that's the only,
Disadvantage.
disadvantage, but it's really nice to have all the information there, just FYI.
Yeah, so at one point in time, in one of the iterations before we've had multiple upgrades to our portal, there was a feature that allowed people to control that. And so you probably got in there at that time. So it's retroed for people who have it, but for anybody going forward, they would have to have their own email address, and then we do have to have that consent. So from a legacy standpoint, that does work for a few people, but we're not really able to support that from the portal. So the patient doesn't have control of that any longer.
Interesting.
So Jack, you and Maureen lucked out.
Got the early version.
Well, that's as long as he talks to me and tells me I've gotten a message.
Gonna say.
She has access to my email, believe me.
There you go. You got the ultimate power. Oh, that's great.
Are there any other questions about the portal? Is there anything that that Taylor can show you? Taylor, if you could go to the main LMH page, and I believe it's down at the very bottom where it says contact us.
There you go.
Yeah, so under contact, so it's the third one over. If you click on that, there is a variety of information here, and you can click on the My Patient Portal questions, and that'll take you to some frequently asked questions. And then there's also a link in there that you can provide information, or you can call the main hospital number 505-5000 and ask to speak to the patient advocate if you're having significant issues with the portal, and they'll route you to someone that can help you, or they'll take your information and give you a call back, or you can fill out a form online and do it that way. But we do have a variety of ways to do that.
Yeah, it's nice to have that outlet in case you're just frustrated and can't quite figure out what you're doing. So thank you for that. All right, anyone else have any additional questions? I was talking to Allison, and as we were waiting to get on, and I think my favorite part of this is the fact that, like, when you get blood work done, it's on the portal way before your doctor ever calls you. So it's kind of fun to click around. There's definitions and ranges that are available, and it's kind of a nice way to wrap your head around it before they do call, so that you can put some good questions together and that sort of thing, so you fully understand what they're trying to tell you. It's a great service. So how is this, like, is your update of this technology just constant? I mean, it sounds like there seems to be a lot of new stuff that seems to come online fairly often with it.
Yeah, so we get updates a couple of times a year, or if there's a security issue, we would get an immediate update. But yes, it's constantly evolving, and new functionality we get a number of times a year. So yes, Taylor stays very busy.
Yeah, no, it pays to kind of check back and see what's available too. I think that, just logging on once, and if you wait a little bit, there'd be even more information available to you. So it's pretty great.
Yeah.
Great.
Well, Kathleen, if there are no other questions, thank you for having us. And I just wanted to publicly thank Taylor for going through this with everybody. He does an amazing job, and we are so lucky to have him at LMH Health. So thank you very much, Taylor.
Absolutely. Thank you.
Thank
Yeah.
you.
It's a really complicated tool and it's hard to explain in a really nice and clear way. And you've achieved that. So thank you.
Thank you.
Really great. So, all right. Well, I guess our next retirement boot camp program is coming up on Thursday at 4 o'clock. It's our tech club. And if you are interested in learning the ins and outs of the library digital resources, like how to access ebooks and audiobooks and free newspapers and magazines and stuff like that, and movies, we'll be offering that this Thursday at 4. So that is, if you go to the main library website, which lplks.org, and scroll down to the bottom, it has all of the listings of events for retirees, and it should be the first one listed. So you can sign up there to get the link. But yeah, so thank you for joining us. And we look forward to seeing you at the next one. And thanks to all our LMH friends.
Thanks so much. Thank you.
Thank you.
Thank you.